What if a simple, daily habit could transform prostate health for older men? Sounds too good to be true, right? But here's the surprising truth. Daily masturbation might just be the key to better blood flow and a healthier prostate. Yes, you heard that correctly. While it's rarely talked about, science suggests that regular ejaculation can improve circulation, reduce inflammation, and even lower the risk of prostate issues. For men over 60, this could mean fewer nighttime bathroom trips, less discomfort, and a better quality of life. But how does it work? And why isn't this common knowledge? The answer lies in understanding the role of blood flow in prostate health, and how small, consistent actions can make a big difference. This isn't about extremes or quick fixes. It's about balance and taking control of your health. So, if you're ready to challenge the myths and explore the science behind this surprising connection, keep reading. Your prostate might thank you. The prostate, a small but vital gland, relies heavily on good blood flow to function properly. Think of it like a car engine. Without oil, it seizes up. Blood delivers oxygen and nutrients, keeping prostate cells healthy and active. It's not just about staying alive. It's about thriving. Without steady circulation, the prostate can't repair itself or fight off inflammation effectively. Picture a bustling city with roads and highways. Blood vessels are like those roads, transporting essential supplies to the prostate. When traffic flows smoothly, everything works perfectly. But if there's a traffic jam or a roadblock, the prostate starts to struggle. That's why maintaining healthy blood flow is so critical. It's the backbone of prostate health, especially as men get older. Here's a real-life example. Imagine two men in their 60s. One stays active, eats well, and keeps his blood flowing freely. His prostate stays in great shape. The other is sedentary, eats poorly, and lets his circulation slow down. His prostate suffers. The difference is clear. It's not just about genetics. It's about choices. And those choices start with understanding how blood flow impacts the prostate. But what happens when blood flow isn't prioritized? The prostate becomes vulnerable. Cells don't get the nutrients they need, and waste products start to build up. Over time, this can lead to bigger problems like inflammation or even disease. It's a slow process, but it's preventable. The key is to keep the blood flowing, and that's where lifestyle comes into play. Stay tuned. Next, we'll explore how aging throws a wrench into this delicate system. As men age, their bodies change in ways they might not expect, and blood flow to the prostate is no exception. Think of it like a garden hose that's been left out in the sun too long. Over time, it becomes less flexible and more prone to kinks. Similarly, blood vessels lose elasticity with age, making it harder for blood to reach the prostate efficiently. This slowdown can have serious consequences for prostate health. The prostate itself also changes as men get older. It can grow larger, a condition known as benign prostatic hyperplasia, BPH. When this happens, it puts pressure on the surrounding blood vessels, further restricting blood flow. It's like trying to water a plant through a pinched hose. The prostate doesn't get what it needs, and over time, this can lead to discomfort or even more serious issues. Here's a practical example. Imagine a man in his 70s who's noticed changes in his urinary habits. He might feel like he's going more often or struggling to empty his bladder completely. These could be signs that blood flow to his prostate isn't what it used to be. It's not just a normal part of aging. It's a signal that something needs attention. And the sooner he acts, the better. But why does this happen? As men age, their bodies produce less nitric oxide, a molecule that helps blood vessels relax and expand. Without it, blood flow becomes sluggish and the prostate suffers. Combine that with a sedentary lifestyle or poor diet, and the problem gets worse. The good news: there are ways to counteract these changes. Stay tuned. Next, we'll dive into how daily habits like masturbation can actually help. Let's talk about something that might raise a few eyebrows but is worth discussing: daily masturbation and its impact on prostate circulation. It's not just a private act. It's a biological process that can actually benefit the prostate. When a man ejaculates, it stimulates the pelvic area, increasing blood flow to the prostate. Think of it like giving the prostate a mini workout. It gets the blood pumping and keeps things moving. Here's how it works. During ejaculation, the muscles in the pelvic region contract, which helps push blood through the prostate and surrounding tissues. This increased circulation delivers more oxygen and nutrients, helping the gland stay healthy. It's like turning on a faucet to flush out a clogged pipe. Over time, this regular activity can help maintain prostate function and even reduce the risk of certain issues. Take, for example, a man in his 50s who makes masturbation a regular part of his routine. He might notice fewer urinary problems or less discomfort in the pelvic area compared to someone who avoids it altogether. It's not a magic cure, but it's a simple, natural way to support prostate health. And the best part, it's something he can do on his own, without any special equipment or medications. But here's the catch. Moderation is key. While regular ejaculation can be beneficial, overdoing it might lead to fatigue or irritation. It's about finding a balance that works for each individual. The prostate thrives on consistency, not extremes. So what's the next step? Stay tuned. We'll explore how this improved circulation can actually prevent prostate diseases. Did you know that by liking the video and subscribing to the channel, YouTube starts recommending more content related to the same video? That's right, do it and stay up to date with your sexual health. Now let's continue. When it comes to prostate health, blood flow isn't just a nice to have, it's a must. Enhanced circulation can be a powerful shield against common prostate diseases like benign prostatic hyperplasia, BPH, and prostatitis. Think of it like a well-oiled machine. When blood flows freely, the prostate gets the nutrients and oxygen it needs to function properly. This reduces the risk of inflammation and keeps the gland from growing too large. Here's the science behind it. Good blood flow helps flush out toxins and waste products that can build up in the prostate. It's like a cleaning crew that works around the clock to keep things tidy. When circulation is strong, the prostate is less likely to become inflamed or infected. This is especially important for older men, who are more prone to these issues as their bodies change. Take, for example, a man in his 60s who's made it a habit to stay active and maintain healthy circulation. He might notice fewer trips to the bathroom at night or less discomfort in his pelvic area. These are signs that his prostate is in good shape, thanks to the steady flow of blood. It's not just luck, it's the result of consistent effort and smart choices. But what happens when blood flow is poor? The prostate becomes a breeding ground for problems. Toxins build up, inflammation sets in, and the risk of disease increases. It's a slippery slope, but one that can be avoided with the right habits. The key is to keep the blood flowing, and that's where lifestyle comes into play. Stay tuned. Next, we'll explore the signs of poor circulation and how to spot them early. Poor circulation to the prostate doesn't always announce itself with a bang. It's more like a slow, creeping issue that builds over time. One of the first signs many men notice is changes in their urinary habits. Maybe they're waking up multiple times at night to use the bathroom or feeling like they can't fully empty their bladder. These subtle shifts can be early warnings that blood flow to the prostate isn't what it should be. Another common sign is discomfort or a dull ache in the pelvic area. It's not always sharp or severe, but it's persistent, like a nagging reminder that something's off. This happens because reduced blood flow can lead to inflammation, which irritates the prostate and surrounding tissues. It's like a car running on low oil. It might keep going, but it's not running smoothly. Here's a real-life example. Imagine a man in his 70s who started noticing these symptoms. At first, he brushes them off as just part of getting older. But over time, they worsen, and he begins to feel fatigued and frustrated. What he doesn't realize is that these issues are linked to poor circulation in his prostate. The sooner he connects the dots, the sooner he can take action. But the effects of poor circulation don't stop there. Over time, it can lead to more serious conditions like chronic prostatitis or even an enlarged prostate. These issues can impact a man's quality of life, making everyday activities uncomfortable or inconvenient. The good news: recognizing the signs early can make all the difference. Stay tuned, next we'll explore practical ways to improve circulation and turn things around. Improving blood flow to the prostate isn't just about one thing. It's about a combination of smart daily habits. Exercise, for example, is a game changer. Activities like walking, swimming, or even yoga get the heart pumping and improve circulation throughout the body, including the prostate. Think of it as giving your entire system a tune-up. Even 30 minutes a day can make a big difference over time. Diet plays a huge role too. Foods rich in antioxidants like berries, nuts, and leafy greens help keep blood vessels healthy and flexible. Omega-3 fatty acids, found in fish like salmon, are another great option because they reduce inflammation and support circulation. It's like fueling your car with premium gas, it just runs better. Small changes in what you eat can have a big impact on prostate health. Stress management is another key piece of the puzzle. Chronic stress can tighten blood vessels and restrict flow, so finding ways to relax is crucial. Whether it's meditation, deep breathing, or simply spending time with loved ones, reducing stress helps keep circulation strong. It's not just good for the mind, it's good for the prostate too. After all, a relaxed body is a healthy body. Here's a practical tip. Try combining these practices into a daily routine. Start with a brisk walk in the morning, add a handful of nuts to your afternoon snack, and wind down with a few minutes of deep breathing before bed. These small steps add up over time, creating a lifestyle that supports prostate health. Stay tuned, next we'll tackle some common myths about masturbation and circulation that might surprise you. Let's clear the air about masturbation and its role in prostate health, because there's a lot of misinformation out there. One common myth is that masturbation weakens the body or drains energy. In reality, it's quite the opposite. Regular ejaculation can actually improve blood flow to the prostate, helping to keep it healthy. It's not about excess. It's about balance and understanding how the body works. Another myth is that masturbation increases the risk of prostate cancer. This one has been debunked by numerous studies, which actually suggest the opposite. Regular ejaculation may help reduce the risk by promoting healthy circulation and flushing out toxins. It's like taking out the trash, keeping things clean and functional. The key is moderation, not avoidance. Here's a real-life example. Imagine a man in his 60s who's heard these myths and avoided masturbation for years. He might be surprised to learn that his prostate could benefit from a more balanced approach. By incorporating it into his routine, he could improve circulation and reduce the risk of issues like inflammation or enlargement. It's not about extremes. It's about what works for his body. The bottom line: masturbation isn't something to fear or feel guilty about. When done in moderation, it's a natural and beneficial part of maintaining prostate health. It's time to let go of the myths and focus on the facts. After all, a healthy prostate is a happy prostate, and that's something worth striving for. So, what's the takeaway from all this? Prostate health doesn't have to be a mystery or a struggle. By understanding the importance of blood flow and taking simple, consistent steps, you can make a real difference. Whether it's through daily habits like masturbation, staying active, or eating a balanced diet, the power to support your prostate is in your hands. Ask yourself, are you ready to take control of your health? Are you willing to make small changes today that could lead to big benefits tomorrow? The choice is yours, and the time to start is now. Your prostate and your quality of life depend on it. If you found this information helpful, don't stop here. Subscribe to the channel and hit the notification bell to stay updated on more tips and insights about prostate health. Knowledge is power, and the more you know, the better you can take care of yourself. Also, watch this video that's appearing on the screen. It's also important. Click on it to keep learning and taking charge of your health. Your future self will thank you.